My medical condition is I have two herniated discs in my lower back.
I have two herniated discs, one the L4-5 disc and the other the L5-S1 disc.
I have scoliosis and also was recently in a car accident.
Well, the last 2 years I had cancer of the bladder and I took chemo, and chemo softened up my backbone. And
the accident that caused my injury to my lower back affected my whole life, personally and professionally, in my ability to walk and do everyday normal tasks.
It happened as a result of a lot of contact sports that I played throughout childhood and high school in particular.
I could no longer bend over to open the dishwasher. I could no longer carry laundry down the stairs. I could no longer play baseball with my kids in the backyard.
My case is not severe, but of course I've had some pain associated with it for years and it was undetected.
Running is very painful for me. A lot of the stretches involved just in any sport is difficult for me. Even just like waking up, like getting out of bed in the morning, standing up from sitting down, any change of position can generally throw out some pain. So it really has a big impact on the way I live my life.
Dr. Ray recommended no medical drugs.
the decompression is the only thing that's probably would have helped me.
It just makes it a little bit easier to get out of bed. There's a little bit less pain each day. It's a little bit easier to run if I want to, play a game, pick up football with friends.
I lead a very active lifestyle. I teach, sing, and model, and so obviously I need to be as pain-free as possible.
Today, 10 months later, I don't have a pain in my body.
Between treatments, my neck is better extended and I have a lot less pain.
At this point, I've used the machine 20 times and have had a decrease of about 80% of the back pain that I have.
Thank you for taking the time to watch this important and informative report of findings and treatment orientation brought to you by this Antalgic Care non-surgical healthcare office. Your doctor has asked you to view this video so that you will clearly understand how new breakthroughs in range of motion decompression therapy are going to be applied during your treatment sessions. What causes back and neck pain? Two of the most common reasons are strenuous activity and repetitive activity. They are precursors to back problems that can create a multitude of injuries. A third reason is limited movement of the spinal joints or fixated spinal vertebrae. Spines with limited or fixated joint movement are more prone to injury, even while performing the simplest activities. All these everyday activities strain and sprain the spine and can cause injury to the disc and surrounding tissues. Understanding the spine's anatomy. To understand the disc, let's review its basic anatomy. Like a jelly donut, the spinal disc is a similarly structured unit. It is comprised of an outer cartilage border that surrounds and contains an inner softer gel. The outer cartilage border is called the annulus fibrosus, and the inner softer gel is called the nucleus pulposus. As vertebrae move, they exert repetitive load pressures onto the disc. When the disc becomes overloaded or over-squeezed, these extra pressures begin to weaken the disc's outer cartilage wall. The job of this wall is to keep the inner disc gel safely inside the disc. The weakened wall can allow the disc's inner gel to bulge outward or herniate beyond the outer wall and onto neighboring nerve roots. This causes debilitating pain. Most patients will not see a doctor until their disc is producing damaging pressure on the nerve. Current treatment methods. Current treatment methods include spinal epidural injections, drugs, chiropractic, nutrition, acupuncture, physical therapy, exercise, or surgery. When a patient chooses surgery, the procedure attempts to shave, burn, or cut away the expanded and bulged disc material that's pressing on or pinching the nerve. These surgeries are risky and often don't produce a favorable outcome. But now you are about to experience a new breakthrough in therapy called Antalgic Track Range of Motion Decompression. Range of motion decompression can only be performed on the Antalgic Track. Antalgic Track is a new FDA-cleared Class II power traction medical device. For many, it can minimize or even eliminate the need for dangerous surgical procedures, needles, and harmful drugs. Antalgic Track is a specialized and computerized spinal decompression system that's designed to gently unpinch nerves. It works by slowly and gradually increasing and improving the disc spacing between spinal vertebrae. Antalgic Track's exclusive range of motion feature is the only system currently available that can strategically position the spine during decompression. And because range of motion is essential for spinal health, combining it with decompression provides an even greater treatment outcome than either therapy alone. This combined range of motion decompression technique has been named Kinetic Decompression Mobilization, or KDM. It is the most advanced decompression treatment system available today. KDM consists of a series of systematic, rhythmic, and gentle movements that improve decompression's ability to target specific areas within the spine. This results in a more effective system. Getting treatment. It's the only system in the world that can strategically position your spine to target and move the decompression pull forces into, around, and through the disc. This enhanced positioning improves where and how the decompression pull forces are focused and moved through the spine. More importantly, this improves the spine's ability to retract the bulging disc off the nerve and back into its pre-pressured border. And for you, as a patient, that means relief. Patients that are accepted into the Antalgic Care KDM program understand that the treatment goal is to remove their pain and to ultimately normalize the dynamic mechanical functions of their spine. Scheduling care. Studies on decompression concluded that a series of closely scheduled sessions produce the best results. Although no health facility can guarantee results, it is logical and recommended to follow the established protocol. It is extremely important that you attend all your scheduled treatment sessions in order to maximize your treatment outcome. Patients must do their part and comply with the treatment guidelines and recommendations specified by their doctors. These closely scheduled sessions also develop an essential treatment momentum. Momentum creates and provides physiologic and anatomical changes that are required to treat all the vertebrae, discs, and nerves, as well as muscles, tendons, and ligaments. Momentum can only be established by closely scheduling your visits. You should also know that Antalgic Care is not continuous, ongoing care. Its objective is to deliver effective, lasting results in a defined and reasonable time frame. Average programs are between 3 and 10 weeks. What's next? This program will reveal everything you need to know to make the important decision to have Antalgic Track non-surgical neck and back care. Introducing the technology of Antalgic Track, utilizing the exclusive KDM therapy. Developed by doctors and engineered to restore the spine's ranges of motion and provide a superb and gentle power traction that can rehabilitate spinal movements and decompress injured and compressed discs. People often wonder, what's the underlying cause to their back pain? Research shows that strenuous and repetitive activities in any area of the spine are precursors to injury. Spines with locked, fixated, or restricted vertebrae can also predispose the spine to injury. This view identifies a herniated disc, which for many is the cause of pain. As a disc becomes overloaded or squeezed, these extra pressures weaken the disc's outer cartilage border. Here, the soft inner gel of the disc has protruded through its outer cartilage border and onto the soft exposed nerve root. The weak outer border allows the inner disc gel to bulge or herniate through the outer cartilage border onto the neighboring nerve roots. This can cause excruciating spinal pains that may radiate into the arms or legs. Conversely, it may even cause numbness. The technology of Antalgic Track and its unique and specialized KDM therapy allows you the opportunity to get the most advanced and gentle power traction therapy available in the world, reducing disc pressure, bulges, herniations, nerve root pressures, and pinched nerves. Antalgic Track is capable of targeting specific areas of the spine using a series of systematic and repetitive movements. These movements unpinch nerves and restore proper spinal movement and function. Antalgic Track also has the ability to position a patient into a pain-free posture prior to the treatment. The exclusive posturing helps shift the disc bulge or herniation away from the compressed nerve roots, making treatment comfortable and relaxing. Antalgic Track's exclusive articulation features enable your doctor to gently reposition the spine, making the pulling forces more effective. Here's how power traction decompresses a disc. Disc height is gradually increased by gently separating the vertebrae. The separation forces create a vacuum phenomenon within the disc to hydrate and draw in nourishing fluids without needles or drugs. Antalgic Track's exclusive range of motion system gives it the ability to accommodate each patient's specific condition, making it the world's most complete range of motion spinal power tractioning system in the world. From the moment you get onto the Antalgic Track, you'll quickly see how comfortable, convenient, and patient-friendly it is.